we've worked hard, as would other schools of nursing, to try to develop a educative process that will deliver quality of care. However, that's has been working in something of an isolated vacuum. Although many of us would be directly or indirectly users of the service, primarily we remain as professional educators and professional clinicians. User and carer involvement will hopefully more effectively focus our work here, our educative process, our learning process for the students on quality of care. I suppose the easiest way to answer that question is to reflect on some of the key areas from the Francis Report 2013. One could talk about certain skills areas, certain areas that were missed or not properly addressed or directed, but predominantly the issue would be, as it is here in Northern Ireland, on quality, on care delivery, and the focus on care delivery, quality and effectiveness of communication, and the reality that the public pays substantial sums of money for the health service, pays substantial sums of money for directly or indirectly for nurse and midwifery education, and they expect their needs and their personhood to be valued, and those would be the key areas that I would expect the user and care involvement to help better develop here within the educative process. It will impact progressively, incrementally. The first stage would be to help develop a better understanding within the school. I mean, the school, and again, not unique to the school here, has worked in something of a vacuum. The professionals, educative and clinical, have set the agenda. The first challenge, if you like, will be to encourage and facilitate colleagues to a closer, progressively integrated partnership in working with users and carers. And then expectedly that will step by step reflect in the curriculum, reflect in the educative process, and then reflect in clinical practice. Okay. Well, first and foremost, the users and carers, the members of the forum, would have to understand the process, which is what we're working on at the moment, so that they can understand what the school is here for, what it's already working with, its areas and focus and curriculum structure and such like, both at an undergraduate but also at a postgraduate level, and also, and importantly, including the areas of research of the school. So to understand the process, then progressively to help to enhance that process, and then in the medium to long term to help direct and to develop the process of education and research here within the school. I think I would go back to the points I made earlier. I would expect it to impact predominantly in terms of quality and quality of care delivery, quality of communication, and better reflecting real patient and person needs.